Okay, hello again. So we have a distinguished panel who I'm going to invite each of the panel members to introduce themselves succinctly. And then I'm going to put some questions to them, and they have 3 minutes each. No more, please. And then we're going to put the questions to the floor for about 15 minutes. So we have these two mics, so shall we start with Simon?
Hello, I'm Simon Bibby, and I'm a water, sanitation and hygiene advisor at DFID.
Hello everyone, I'm Archana, Patkar, and I'm Program Manager Networking and Knowledge Management at the Water Supply and Sanitation Collaborative Council in Geneva.
Hello, I'm Sanjay Wijesekera, and I'm Chief of WaterAid at UNICEF.
Hello, good evening. I'm Spera, Atuhairwe, Head of Program Effectiveness, WaterAid in Uganda.
Thank you very much. Okay, so I'm going to put one question to Simon and Archana. You can decide amongst yourself who's answering it first. And the question is, the Millennium Development Goals have been successful, more or less, ... in focusing the international community and national governments to deliver on sector-specific targets. But to some extent, they have also compartmentalized issues and sectors and silos. I'll add that bit. As we've heard, the challenges faced by women and girls, from all the presentations we've heard this, are multidimensional and complex and can cross such lines. So, Simon and Archana, reflecting on the presentations and your experience, what opportunities do the current discussions on the post-2015 development agenda provide to promote intersectoral approaches to address gender inequities relating to women's rights, sanitation and health?
Thank you very much. Nice, easy question to start with. I think quite encouraging news coming back from Bali. The high-level panel there is obviously very, very committed to attacking and tackling gender inequities. And I think there's a very strong desire to really build on MDG 3 and to really start to ensure that gender equity and empowerment of girls and women is a reality. So I think the message that's coming through is very much that there will be, or there will certainly be, a lot of pressure to have a standalone goal to promote that. But then all important, I think, to this discussion is to have that cross-cutting, mainstreamed issue of making sure that key gender issues are being addressed right across the sector. And I think some of the very eloquent images that we've seen there in terms of ensuring that wash facilities, for example, are available in clinics, that wash facilities are available in schools, that there is the linkage between the community and the schools, that there is the linkage between the community, the schools, and the health service centre. I was recently in Sierra Leone, where the programme there actually is run out of an office that links around MDG delivery. So there's actually an attempt to provide services in the different areas and trying to work them together. So that is quite encouraging. And I think that certainly from a DFID point of view, that is definitely the way forward, is to try and bring a much more integrated way of working. It might not be pure integration, but it's more of a convergent cooperation partnership between the different sectors to try and get to build those synergies as far as possible. So I personally believe that there is quite a lot of encouraging moves to have gender inequities addressed through a much more integrated way of working. But of course, there's lots of different elements of the post-2015 agenda which are in action as we speak. We've got the Sustainable Development Goals being developed, we've got the Millennium Development Goals, we've got several different fora which are discussing these. So it's going to be quite a challenge to build that consensus. And I think there are people in this room who've got a role in that process, and I think we urge them to take that on and build the consensus.
I think these are really exciting times. When I think back more than 20 years ago, and I did dare to talk about menstruation and menstrual hygiene more than 20 years ago, and people would just, whether it was in India or Bangladesh or in West Africa, people would just listen with respect. In other parts of the world, not in India necessarily, and just go on with the conversation. You know, and in India, people would usually say, oh, there are much more important things for us to worry about. And then, of course, talking to WASH professionals, also very often, the response was, oh, we have such a big job, you know, to even get sanitation on the agenda. Let's not worry about menstruation. And, of course, my response always would be, well, you wouldn't be saying that if you're a woman. If you are a woman and you're saying that, then really, let's think again about what sanitation means. I think it's very exciting to be here, but also to hear across the world what was a silent, stigmatized issue coming to the fore, because I do believe, and we've heard it said many times today, that the first step is to break the silence and to break the taboos. The market will respond automatically, like it always does when there's demand. But if we don't break the silence and if we don't break the taboos, there is no demand. And we can't continue delivering WASH services without listening to the silent demand, making it kind of center stage, helping it to be articulated. So in terms of the MDGs and looking back, yes, they did really help to focus attention on poverty reduction. But by ignoring the social and political stratifiers of inequality and by focusing on the economic stratifiers of inequality, I think they really did women more than anybody else a real disservice, women and girls, because really this menstrual hygiene is a fantastic example of this. You know, it's a meta indicator that cuts across. Talk about making connections. You know, first of all, let's think across a human life cycle when we talk about delivering services. Services are not about taps or toilets or health clinics. They are about people, first and foremost. And people, you know, go through a life cycle: infancy, childhood, puberty, childbirth, old age, and eventually death. And if we really look at this life cycle, it becomes increasingly clear that you can't deliver services in any sector without really keeping human needs center stage. And then that brings about a whole different design, which is not cloned for a certain kind of client, or only for disabled people, or only for women, but takes note of this life cycle across an entire human being's living time, and also recognizes that people don't spend their entire lives in the household, but really work, play, travel, etc. Just seeing what is out there in terms of the technical outputs of the post-2015 process for WASH is wildly exciting for me. I know it's a technical output that will be vetted politically at many levels, but let's not forget that many countries are looking at this now in terms of policy, and definitely in terms of practice. We have this huge compendium that is a fabulous resource that shows us there are many, many islands of excellence out there. It's for us now to take that together with the movement on the policy front and bring it all together to coalesce really around women's rights. And I can't think of a better meta indicator for equality and gender than menstrual hygiene management across sectors.
Thank you, Archana and Simon. Over to Sanjay. So, reflecting on the importance of addressing these issues in the light of the presentations and your own experience of addressing these issues with children and adolescents, boys and girls, to address both the practical needs and the stigma, taboos and inequalities. What are successful approaches? What is needed to institutionalize them?
Thank you. And I noticed Simon got the easy question. Yeah, okay. But first of all, to say thank you very much. I feel quite privileged to be here. So thanks to everyone involved in inviting us. And I can't even pretend to match the depth and substance of the presentations that were given. But from my perspective, just a couple of maybe just observations, and then if I have time, I might be able to say something about UNICEF and actually answer your question. But if I don't, you'll have to ask it again. Exactly. Just a couple of in terms of the observations that struck me whilst I was listening to the presentations was one is around a visit I had of one of the largest hygiene programs in the world, I guess, the Atuhairwe program in Bangladesh with the Bangladesh government. And one of the elements in that is a peri-urban element where there are groups of adolescent girls in different peri-urban areas who develop plans, if you like, community action plans, but who prioritize plans on what in their communities should improve and can be changed, and what they can do to make those changes. So these are, very, very, I'd say, very powerful girls who will be very powerful women one day, and they're very inspiring. And one of the things that I saw was they showed us all of the mapping of the community and what they had in store and the timeline and so on. But also they showed us a shop that they had created, and that involved it started off mainly around making sanitary pads, and they were doing that, and who better to design and manufacture these for a market, and they understand the market really well. So they did that, and based on the success of that, they expanded it to other hygiene products and household products, including soap and toilet cleaner, and they expanded it, and this was a thriving business in this area, and that was, to me, was incredibly inspiring, because what it showed was that that these girls were able to take this with very little help and very low unit cost. Simon, you'd be happy to hear. They were able to make transformational change, so not just delivering services, but actually making it much wider in terms of empowerment. The second issue was I was talking to I don't know whether there's anyone from Unilever here, but Unilever very I think in a very enlightened manner support our sanitation programming on community approaches to total sanitation. And I was talking to one of their senior vice presidents, Sue Gerard, and she used to, not about Unilever, but about her former work in the Department of Social Services. And she was a senior manager in DSS, and most of us, or I did at least, just think DSS just give pensions and handouts and so on. But what they actually are dealing with is long-term and deep poverty in the UK. And we had this conversation about dignity and the kind of benefits of sanitation on both saving lives but also on dignity, and how that's very difficult to measure. And to cut a long story short, what she told me was that dignity or self-respect is one of the biggest indicators of whether somebody who loses a job will actually get back into the workforce. So it's one of the key things in the UK that you would target in terms of public policy if you want to address long-term unemployment. But what amazed me was that it is measured, because obviously if it's something that's going to be addressed, it has to be measured. And so in the UK, it is measured as a thing, as an indicator, and that's the dignity piece. I think is something that is really important and that cuts across all of this.
I'm sorry, we're going to have to leave
come back to the other
UNICEF a
things
mystery
later.
at the moment. Sorry to cut you off. Last question is to Spera on one end and Wendy at the other. Very good logistics. I'll start with Spera. So the question is, we work with limited resources and often in resource poor contexts, and we need to make choices on key priorities. What is the key priority? Working collaboratively, however, usually means more complexity and more time. So, again, reflecting on the presentations and on your experience, what are the incentives you see in your work for putting in this additional effort? What evidence do we need to convince others that the extra time and complexity is worth the effort?
Thank you, Rose, and I appreciate the opportunity to come here and share my experience. I'll start off by mentioning that really coming together to address some of these issues that are underlying in our society and that affect WASH and other services that we deliver, really by mandate organizations, governments, and multinational organizations expected to really work on them. And then, of course, the global call to action requires that there is more collaboration, and they need to come together and utilize the limited resources to deliver more efficiently. But most importantly, as we've shared here in the presentations, we realize that a lot of experience exists, a lot of solutions exist, but maybe making them work in different contexts is what is missing. So organizations need to come together and share these experiences, share the learning. We have also realized that actually tackling some of these issues and working, coming together as a force really helps to appreciate and understand the underlying causes. Talking about issues of gender, issues of violence, this has been on long enough, I think, as far as the world started. But the challenges are still with us. And so the more need for us to work together. Yes, a lot of effort has been made, a lot of steps have been made, but there's more need to work together. There's evidence that shows that if organizations come together, they are able to help, for instance, women take charge of their development. You realize that, for instance, in developing countries, most of the women are engaged in agriculture. And so if they have access to hygiene and sanitation services, they are able to increase their productivity of their farmland by at least 20 to 30%. And eventually that may increase contribution to national growth, maybe to around 4 to 5%. But for us to have this evidence and convince different actors, we have to work together, generate the evidence together, and use it to convince the powers that be. As you're aware that some of these issues can turn political, both right from the household, to the community, to the local government, to the national level. I'll give an example. I think those who have been following closely what has been happening in Uganda. There has been a discussion around the marriage and divorce bill. But it has been thrown out. It has been in discussion for the last 40 years. But because it had some contentious issues around poverty, around property rights, around rights within the marriage, within the home. So the bill was thrown out because basically the way people believe and think culturally, socially, so they are not able to convince that actually this is going to work. So we need a bigger force that will actually help change the attitudes, create the mind shift that we need in order to make progress. And we all know that if women are empowered and are living better lives, then that means we have more retention in school, we have people who are educated and can contribute productively to the economy. So I think really, this is good evidence that we need to work more collaboratively, but we need to break the silence and talk about these issues if we have to make a lot of progress.
Thank you very much, Spera. Over to Wendy.
Thank you very much. Yes, the question about incentives to work together. I mean, at one level, it seems to me it's sort of what you might call blindingly obvious, I suppose, is that we can't do it alone. And I think it's interesting. Both Laurie and I had come after years of working in a particular field, of realising that actually there's a gap, and that there are others working in parallel tracks. And so I think one of the incentives is this sort of self-realisation that you can't do it alone. But I think that comes from where you're trying to go. If you're trying to make a difference, it's thinking about the outcomes that you're trying to impact upon that really encourage you to think about making the collaboration. I think another incentive is recognising that solutions will be better, as it were, if you work collaboratively, in terms of more creativity, more cross-learning, and I think there's a huge opportunity for more cross-learning between areas, to end up with what I might call non-naive interventions. I mean, how many times have we seen all are saying there's no magic bullet, but seeing something being tried as a very naive single intervention that is simply not going to work because it hasn't joined up with the other areas that are necessary, be that behaviour change or be that the environment in which change is necessary. I think there are other incentives, other areas, incentives in terms of very pragmatic. I mean, we have shortage of resources. We can go further if we pool, and that's both technical resources and financial resources. I mean, I know of some great projects where people have got further by pooling. So I think there's a real pragmatism involved. And I think at the end of the day, there's also a fun element to it. When you're challenged by others that are coming from a different mindset, when they challenge your thinking, they give you also skills. So I think at lots of levels, the four issues: self-realisation that you can't do it alone. We end up with better solutions if we collaborate, and that's also something we have to recognise. There's a win-win from linking up in terms of sharing resources. And I think we have to recognise the creativity that comes and the fun that can come from collaborating. I guess my last point is I think we need, and as I look at the lovely young faces here, I do think we need to think about the role of training institutions, because my sense is, I mean, I'm too late for this, as it were. I've hybridised, I've gone into other areas as I've gone through the career because opportunities I've been given. We need to create a generation of hybrids that move between the spaces of academic research, as it were, and action research, the move between the NGO sector and the academic sector. We need more individuals that enable us to collaborate, because when you get to a certain age, it's much harder. If we build a generation of individuals that move between spaces, I think we're going to be in a better place in a few years' time.
Thank you very much, and thank you to all panellists for their wonderful contributions. We have, I think, 10 minutes for questions. If anybody has any questions, we have some roving microphones. Could you please introduce yourselves, and if your question is for a particular panellist, do let us know. Thank you.
Hi, I'm Katie Fitzpatrick. I'm a PhD student from Cambridge. I'm not directing this question towards anyone in particular, but a more general question of how do we get boys and men involved? I mean, it's an obvious question, but for any step we make for women in terms of empowering themselves, it could be a step taken back if they encounter boys or men who have myths about menstruation, who have really negative attitudes about menstruation. So how do we engage with them in breaking the silence? Thanks.
Okay, well, let's ask the men.
Thanks very much. I'm wearing the bracelet. Yes, part of that is being more aware. I think it's quite interesting when I look at the sort of indicators that are being proposed. And I think it sort of really speaks as to how difficult it is, because, you know, when we're talking about issues particularly around violence, for example, how do we actually get that message across and make it unacceptable, and how do we actually first of all do all the promotion work, and then how do we actually measure that it's happening? And I think I personally have absolutely no experience of this in terms of how you raise awareness around these issues, and I think it is an incredibly challenging area, and I think you know, hopefully there are people much cleverer than I am who are working on these aspects of behaviour change at schools and clinics and the rest of it, and that hopefully we can get these sorts of attitudes across. But I personally think that it's the reinforcement. Sanjay mentioned Unilever and how we're sort of increasingly recognizing that we must understand behaviors and what are the triggers that cause different people to behave in different ways. And I think that there's a much more sophisticated look at behavior change now, and I think we're starting to crack that nut, and I think we're recognizing the multiple routes in, the reinforcement and trying to use influential figures, so whether it's a pop star or a sports star or whatever, to try and set a good example, if they are setting a good example, of course. Not all sports stars do that. So I think, it is a real challenge, and I'm really sorry that you asked me first, because, or maybe they're thanking me for being so blundering about that, but I think it's a really good question. Sanjay, yes.
Yeah, thanks. Just very quickly, I mean, I don't go to church very often, but when I do, I read the book that's in front of me, which is the Bible, and the Old Testament has this thing about, putting women away when they're menstruating and also during delivery, and there might have been. I'm not setting out to offend anyone. There might have been very good intentions and thinking behind that, but translated couple of thousand years later, it's been reinterpreted and misinterpreted. So, and that's one example. And so we're into very, very deep social norms and having to establish or change social norms. Simon did mention that we're actually getting quite good at it, and we do it in sanitation. We create a social norm across tens of thousands of communities for people to use toilets where they weren't before. So I think it's no longer a kind of woolly, fluffy thing. The positive thing is it can be done.
Just for my two penneth. As far as I could tell from the Yatra, the best way to get boys and men interested in menstruation is to tell them they're not allowed to know about it, and not allowed in the tent. No. Anybody else with a question? Oh, sorry, you've got the microphone. We'll come to you
It's
next.
actually a comment rather than a question.
Oh, okay.
Okay. Okay, no, thanks very much for the brilliant presentations and comments, and it's very exciting to be talking about the linkages and how to engage men and boys, but also women and girls in these very difficult issues. I just wanted to let everyone be aware of another piece of research that's ongoing at the moment relating to gender-based violence and WASH, which has followed on from some of the presentations and issues that were presented today. We're trying to develop, funded by the SHARE consortium, being undertaken by WaterAid. We're undertaking research to try and develop a toolkit for practitioners to try and understand better the linkages between sanitation sanitation, gender-based violence, sanitation, or water sanitation, hygiene, gender-based violence, and what we can do better to try and reduce the risks, and then also what we can do when gender-based violence actually occurs. So we're trying to make linkages with the protection sector in the sort of development of these guidelines. So if you're interested, there is a handout downstairs, so please pick it up. We'll be really happy to hear from you. Thank you.
Thanks very much. Just before we come to your question, just Archana would like 10 seconds to introduce another important piece of research.
It's just I'm aware that we are with a lot of SHARE partners here, and the topic is making connections, and SHARE and DFID funded SHARE, and also DFID funds us. We've come together to collaborate on a piece of research on women and health, which looks at 4 different areas, really linked to psychosocial stress, many of the issues raised today, including vulnerability and really increased vulnerability as a result of poor sanitation services, but also looking to make the connection and deepen the evidence on the linkages between MHM and infections or poor health, and lastly also the links with violence. So looking to share that and make the connections even further.
Thank you very much. This is going to be the final question, as we're a bit out of time.
Okay, I'll keep it very quick then.
Thank you.
I just wanted to ask, because it seems to me that what menstruation is it's part of a cycle. It's the fertility cycle. And I was just wondering, I wanted to ask panelists if they were aware and I don't know how many women are aware, that a woman from adolescence to the menopause can track her fertility every day. And it seems to me that an important part of this whole area is educating boys and girls from their first period to say that this is your fertility, you're fertile. And there's a global program called Teen Star which does this. And the boys, but particularly the women, when they come out of this program and they understand their fertility and they understand every day they can know, am I fertile today or am I not fertile? They say that is empowering. And it has a maturing effect on the boys as well, because they realize they don't have a fertility cycle, they're just in a straight line. And I just wonder, the question is, are panelists aware of this? Because I really think, I defer to you on hygiene absolutely and all the rest of it, but I'm just wondering if this is something that's come in to all these organizations thinking, because I worry that it hasn't.
Thanks. Of course, we couldn't go deep into approaches, etc., but this is the way the Council is approaching, and many of our partners, I know, are approaching this is as an integral part of the sexual reproductive health. Not just the cycle, but the entire, all the issues linked to it. And the photographs you saw in the yatra and the tools used, which are very simple. I just want to really point out to the two tools we used. One was for young boys and young girls, a little flip book, which shows how a baby changes for a boy baby and a girl baby, and you just open it out through puberty and beyond. So showing the changes in the body, and of course the implications of those changes all the way. The second tool was a wheel, which I believe is downstairs. You can look at it, which is again the sexual reproductive health cycle and menstruation, and where it fits in there. But the issue really was about how do you bring something that is responsible for perpetuating the human race, really, out of shame and silence, into a sphere and a space where there is pride.
Sorry. Yeah, I mean, I really welcome any advice. I think from my point of view, it's been a really interesting opportunity for me to explore areas that I really hadn't explored before. And I mean, on top of the list around menstrual hygiene, there was a list of various other inequalities and challenges which are facing women in terms of female and infanticide, sexual subjugation, citizens' rights, not having the custody of their children, victims of violence, which we've heard about a lot, their rights to travel, access to education, rights to divorce, clothing restrictions, and more sort of westernized, forbidden from driving. But you've got lots of different examples of this, and I think that level of awareness, giving us some sort of really good things that we can start to look at and get in there as an awareness-raising tool is a very useful one. So thank you for that.
Thank you very much. Very briefly, Sanjay, please, because we are out of time. Thank you.
Thank you very much. Just to say that I think that's really important, and I think a lot of the progress in terms of addressing these issues are around the knowledge piece, and we had a virtual conference with Columbia University in September of last year. Some of you may have taken part in, about 200 people did, where a lot of these lessons were brought together, and they're actually have just been written up. And I was just reading through it coming here, and it's fascinating, and it's from at least 14 countries of both the kind of problems and the attitudes, but also some of the solutions that people have deployed. So from our perspective, from UNICEF's perspective, which is also what I was going to say, we're going to invest a lot in the knowledge piece of this, in learning the kind of, both in understanding it, but also learning the kind of approaches that work and that deliver results, and also, of course, in supporting whatever coalitions of action there are on these issues. Thank you.
Thank you. Not necessarily aware of that initiative you're talking about, but in our menstrual hygiene work, especially in schools, that is largely emphasized away from the traditional way of taking away girls and maybe working with a head woman or senior woman teacher, but actually discussing menstrual hygiene issues in class, and they are part of the curriculum, and they have school health clubs where they discuss menstrual hygiene issues openly, and also the school administration is involved, and they actually engaging parents to make sure that they actually provide for their girls with pads. In some of our urban work in Kampala, the requirement is that even boys actually contribute pads in school, so they are aware and they know that it is going to contribute to improved sanitation and hygiene in school. So we are integrating all that, and it's part of the training as part of reproductive health in science subjects.
Okay, thank you very much. Sorry not to bring you in again, Wendy. Thanks for the questions. Thank you to the panelists. And I'm going to hand over now to Helen, who is going to wrap up.